Okay, hello everyone. Good evening. It's really pleasure to see all of you so enthusiastic, smiling, happy, and you always elevate our moods also. So thank you for your inspiration. And today we have Dr. Abhishek Kini with us. He is going to discuss on foot and ankle reconstruction. So Dr. Abhishek Kini is a dedicated foot and ankle fellowship trained surgeon having experience of more than 9 years with his training in UK and Holland. Dr. Kini has treated variety of cases from athlete to common man during his practice in Mumbai and other cities of the country. Dr. Kini, with his specialized training in foot and ankle reconstruction, offers minimal invasive keyhole surgery for foot and ankle problems, which enables patients to recover quickly and resume work duties sports at the earliest. So now I welcome Dr. Kini and I am handing over to you. Thank you so much.
Thank you, Kusumji. Thank you, the foundation. It's actually a pleasure talking to all of y'all. I really hope you all don't need the doctor in me, but as otherwise, just for routine general advice and all, we are always happy to help. And we all have parents. And even though we live in the same city, but I guess I can wholeheartedly connect to you all what they must be going through when they must be also be logging in on such things. Uh, so I think we'll keep it very informal. Um, I'm not going to talk about some major conditions that I treat or something. So what I thought today, when Kaushal gave me the lead on what we do and what this foundation does, I think it's important that we'll cover very basic things like what is a proper footwear selection, something like that. Then what would be basic common conditions like heel pain, uh, flat feet, and then toe deformities that really trouble a lot of our senior citizens. And these are basic conditions that where I feel prevention is always better than cure. And in all these, like in the next 1 hour or so, if I can come across and help you give those few points which will actually keep you away from me, I think I will sleep better tonight. So I'll start at any point of time. If you all have any questions or something, just feel free to stop me in the way and ask, or even you can type on the chat box next to us, and Kusum or Kaushal can let us know and we can take things up from there. So as Kusum just mentioned that yes, I am a foot and ankle surgeon, but I think over here I'm just Abhishek for all of y'all, and y'all can just address me by first name, and we can just talk as more of preventive pathologies where we can help things go, or we can prevent things from getting worse from what it is. So a very good evening to all of y'all. So we'll start basically with making correct footwear choices. So we all know that humans have evolved. Humans have evolved from four legs animal to two legs creatures. So in this evolution, what has happened is uh, our foot has also evolved, and it's actually a very architectural genius that it is. It has evolved from being flexible to hold on to the branches to being more stable and stability oriented, where now it has to take the weight of our body and help us move forward. So foot is actually very, very important. However uh, high or however important we feel the spine, the knee, but foot, if something's wrong, you really can't use extremely well done knee replacement or extremely well done spine surgery if the feet are not working. So in this evolution of humans and their feet, what has happened is it has become extremely calf dependent and has a lot of things to do with balance, because when we were on our four legs we didn't need balance. So genetically we don't have this balance as a reflex. Like, if you bring fire close to you, we all withdraw. So that's an innate means inborn reflex, but balance we don't have. That's one very important thing that, everyone above 50 or 60 years especially, we all lose our ability to balance, and this leads to falls. And as we all know that in world like WHO, the literature, that falls are the highest predictor for morbidity, not mortality, matlab no death related things, but morbidity, where people have falls, they break their hip bones, they break their spines, they break their ankle, knee, and that causes more morbidity. So feet again play a very big role in preventing those falls, where we have to work on those balance, and it's more like a toilet training where you have to do some exercises to get those balance and all. So with this brief, I would say historical or evolution, we would go on the first section of our talk, which is on feet selection. So feet in our ancient culture also has played or footwear has also played a big role in our culture, where, where during Vanvas, Bharat took Ramji's footwear and placed it on the pedestal at Ayodhya as his mark, as his presence. So right from that times Ramayana to this nowadays Ram Leela, where we know that footwear options are from stilettos to Oxford shoes to everything, and it plays a big role what we need to select and what we should not select considering our feet feet types. So what is the basic function of any footwear? So primarily it deals with protection, where it prevents our feet from getting injured in the environment that we live in, whether it's jungles, fields, roads, or even at house indoors. It also gives us stability, where the footwear helps our feet maintain our balance and inability to fall down. It helps us overcome disability, where certain people who have diabetic feet or polio or certain nerve, like where we have stroke patients, where they don't have balance in their feet, that disability is overcome by using proper footwear. It says okay. And lastly, it also helps us in achieving goals, especially if you are into adventure sports where you need to run marathon, you need to climb a trek, or you need to ski and everything. It helps. So with these four basic functions of any footwear, we need to look what is an ideal footwear for us. So is there something called a best footwear? There is no footwear which can be, or no one footwear which can be given the crown of the best footwear. What it needs is, uh, nothing is ideal. It depends entirely on the foot type and the demand. So someone who has a flat foot like this will not be the same footwear that has a high arch like this, or someone who's had an injury, just twisting injury, can't have this, uh, can't use the normal chappals that has been wearing on. So there's nothing is ideal. So demand depends on whether you're skiing or running on the beach, or whether you're walking on a red carpet. So footwear, you need to take into type what are the foot types and the demand. So we'll discuss each type of footwear, and then we'll take a small break after every 10-15 minutes where we can have some questions. So the most commonly used footwear that we see are slippers. They are easiest but dangerous. They are easy because our Indian culture doesn't, or rather in our Indian culture, we keep our footwear outside on the door and we go inside. So these slippers are very easy to take out and wear whenever you want them, or take them out, but they don't provide any support to the feet. They have no protection, they have zero stability, they are very flimsy, and they are extremely prone to ankle twisting injuries, toe deformities, because when, like in subsequent slides, we will see that we see toe deformities, curling of toes, and postural problems. So if you ask me, if my dad or mom wants to buy a footwear, and if they tell me, Baba, should we wear these slippers? I would strictly say a no, no, because of all these disadvantages that slippers bring. Going next to the another common footwear is something slightly better than our slippers, what we call it as chappals or fit flops. They are comfortable but also can bring agony in deformed patients. Like in feet, someone whose feet are deformed, they can be extremely agonizing because they don't provide any support or protection. They're slightly better in stability because the straps are slightly thicker, but they don't have any arch supports over here. And they also cause a lot of heel pain, twisting injuries, and can cause a slip and fall. So slightly better than than the slippers, but again not the good one. The next one that we see, especially in gentlemen, is sandals, which you kind of see like this, something like a woodland or something bata, or platforms or wedges in ladies. They are comfortable and functional because we live in the tropical climate where there is like a lot of humidity and heat. They allow our feet to breathe better. They are better in support and protection, but again, they do not have any arch supports over here. Arch support orthotics can be inserted in them, but again, lot of patients who get back of heel pain will complain because of this strap. And again, these footwears don't allow us or any prevent from any twisting injuries. So next is the most common office wear or school wear, what we call as formal shoes or Oxford shoes. They are comfortable, but depending on the fit, they are much better support. Protection is there. No arch supports, but they can be inserted by a good arch support inside and used with an orthotic or an insole. Again, too tight shoes can cause back of the heel pain. Sometimes they can cause foot cramping, toe pain, and deformities, and midfoot arch. Like below the foot, you can get some midfoot arch pain because of these things. Next, very common, and I feel one of the most comfortable shoes in current times are sport shoes or sneakers. They are comfort wear, activity wear, comfortable. They are a great mix of form and function. They're much better support. They give proper protection to the front of the foot. They can be applied arch supports orthotics in this, and they are easy to accommodate extra padding or modification depending on. Sometimes some people have diabetic foot where they have ulcers, so we can all play with these footwears in a much better way than something else. Lastly, high heels or stilettos, not much roll over here, but still they are fashion, not always comfortable, aesthetic, but no support, no protection, no arch support. A lot of people come to me because of injuries because of them. But yes, there is a science in selecting it. Unfortunately, not many people know how to select a proper high heels or something, but they are good ones to try when you have proper thing. So this is something that has actually changed my practice or changed foot and ankle practice a lot. They are customized footwear. So nowadays, especially in a city like Bombay, Pune, or even Chennai, Bangalore, big towns, they are customized footwear options. They are not aesthetic, but they are extremely functional. So if you have a broad foot like this, there are people who will measure your foot. They will map your foot where it is, how broad you are, and accordingly they can make a shoe customized for you. Some people who have like limb length, like one leg is shorter than the other, you can add some bottom soles to it. Someone who has a flat foot can cause arch support footwear. Some orthotics can be applied, like calipers can be put. So they have a big role in footwear selection, where any disability like polio, nerve weakness, instability, where people are twisting their ankles too frequently, or post-traumatic conditions, or people with flat feet who have a standing job, height difference, and diabetic feet. All these are extremely well treated with a customized footwear. Yes, they don't look good, but I think they are very functional, and people are very, very happy with it. So before we go on to the next section, any questions, sir? Anyone who wants to unmute and like ask me questions on footwear selections? Any doubt? Chat has. So Madhu Pawa is asking how to overcome flat feet developed with age of 60 years. Having cushion, heel cushion. Some tissues are developed between ankle and heel. So, Miss Pawa, I think you for flat feet you get good customized insoles, which are like these types. The one on the bottom left, bottom right side of my screen. If you wear them in your sport shoes, I think that would be the most comfortable shoe for you, and that's how your basically your pain that comes due to your flat feet can be overcome by that. So I think you should try customized insoles with medial arch supports. Medial arch supports. Haresh ji is asking, yes. So Haresh ji has a very common problem that we see in our elderly population. That's left ankle. Ankle gets swollen and causing imbalance and difficulty to walk. Uh, So you need to find out what are the reasons for causing that imbalance. There can be a neurologic reason which can be due to age, like peripheral neuropathy, diabetes, and other things. And ankle swelling can be due to arthritis, which is again age related things. So both are slightly different pathologies, but both can coexist in one and cause this trouble to you, which is very common. So you need to go one by one. If it is arthritis, you need to start a short course of anti-inflammatory medicines, ice it, build your physiotherapy muscles. And for your imbalance, again, customized shoes which will have proper ankle supports and doesn't allow your ankle to imbalance, so that while you're walking outdoors, especially on the roads that we have, you are much more comfortable than anything else. Pushkala ma'am is asking, change of footwear, continuous pain all these years has disappeared. Exactly, that's what we just mentioned. That proper footwear can actually help you come out of agonizing pain. Pulling sensation often in my left toe. Uh, Pulling sensation again, the red flag of pulling or the danger sign of pulling sensation is you need to rule out if there is any spinal problem, because spine problem can cause pulling sensations, especially in your toes and feet. So maybe once get it checked by a neurologist or someone who can help you address that problem properly. Doctor chappals are good, they are cushioned and they are comfortable, but they are only two straps. So if you have Dr. Chappals, you can go to your local cobbler or the mochi who's just around the corner, ask him to put a back strap which will allow you to kind of wear them properly. MICR chappals are again like Dr. Chappals. Dr. Scholl's chappals or sandals are again very good because they have arch support, they are better. Mostly I get my Shraddha ji is asking, fingers next to the toes gets twisted. uh, Shraddha ji, maybe Kusum can give you my number. You can WhatsApp me one of your a photograph of your toes, and it would help me better understand what next to be advised for you. Swelling in the ankles, as I just mentioned, we need to find out what is the reason of swelling, whether it is arthritis or not, and go on. Cure for Achilles tendinitis, Nagaraji, I'll be talking about that in my in my further talk. Almost crushed when I visit. Great. My clinic is at Dadar and Pedder Road, but I guess we will. These guys will give you my number, and if you need any help, I'll be very happy to help you. So I think with this, we'll try and go ahead and talk about other common things that easily affect, and I think that will answer a lot of your questions, and we can go slowly and steadily ahead. So the next very common thing that I see is heel pain. So heel pain is very common and seen all across the population, very commonly misdiagnosed as heel spur, where we'll talk about it in the next few slides. It's not always the heel spur. And there is a lot of misinformation that why it happens and how it happens. And some people are told that you have to live with it and everything. And it's nothing like that. And it's extremely well treated. So basically, heel pain has two subsets. One, below the heel pain, like heel ke niche, infracalcaneal. So if I have this bone model, infracalcaneal will be below, over here, and one is retro, one is behind the calcaneum, like on the back side of the calcaneum, that is retrocalcaneal, where the Achilles comes. This is below the heel and this is behind the heel. So they are two completely different problems, and they need to be addressed in a very different way. So infracalcaneal, as we know, plantar fasciitis is the commonest, but you can also get heel fat pad atrophy, again very common in elderly population, where due to aging we see our fat or any our body fat atrophying. Stress fractures, which in patients or in senior citizens who've gone on pilgrimage where they have had to walk a lot, considering their osteoporosis, they can get calcaneal stress fractures. There are certain nerves which get pinched in your feet, and certain arthritis conditions can cause this. Some similarly, back of the heel pain can be because of Achilles, like what we call it as a Hageland syndrome, tendoachilles insertional tendinosis, where it gets inserted, and there is a bursitis where there is swelling at the back of the ankle over here. So going one by one, very commonly what we see is, once whenever patient comes to me, the general doctor has asked for an X-ray, and when I ask my patients like दीदी क्या तकलीफ हो रहा है आपको, तो they tell me कि heel spur है. So this is what the exact picture is. So when you see this X-ray, you see a heel spur over here, and this heel spur is seen in 50% of population, which is irrespective, like, and it's seen in both the sides also, sometimes that sides which are not painful also. Now if I have to give you a something similar example, heel spur, if it was like a nail, like a khila in your shoe, that khila would, or that nail would always hurt you on every step, irrespective of whether it is the first step, second step, 100 steps, 1000 steps, morning, afternoon, evening, night. Contrary to this, heel spur pain is more in the morning, and as the day progresses, the pain goes. So as the day progresses, does this nail or does this khila, like a tortoise, take its head inside? No, it doesn't go down. So you have to understand that this heel spur is not pathologic. The one below your heel is not pathologic. Yes, rarely it can be, but most of the times it is not. This heel spur is at the origin of another muscle which is not painful. Your pain at this is plantar fascia, but not this heel spur. Back of the heel pain is, again, yes, these spurs can be painful, where they are a different pathology. But below the heel pain, this heel spur are not always pathologic. So please don't tell that is painful. So coming to below the heel pain that we are going to talk, plantar fascia, most common condition due to irritation of the inner side of plantar fascia. It's more in the early morning or initiation or start of movement, and is associated with calf tightness. Your calf muscle being tight causes this pain. On when you examine it, you will feel, and the patient will point finger at the inner side of your heel and say that this is painful. And these are very classically diagnosed. How does this go? This goes only with physiotherapy. Like you need regular stretching of your calf muscles and your plantar fascia. In very resistant cases, we give night splint, something like this, or we give injections. But injections are given under sonography guidance, so that you inject it at the right place and minimum quantity. Very rarely, like once in a year or twice in a year, in some pathological conditions, I might do a surgery. But yeah, the indications for surgery for this condition are extremely rare. So what he needs is more of exercises and stretches. So how do you differentiate between other causes of heel pain? Plantar fasciitis is early morning pain, more on the first few steps, and better as they start walking. Heel fat pad atrophy, where because of aging, the fat pad, the cushion of your foot, has become lesser or atrophied. pain on walking, and every step similar pain is there. They may have taken some injection which has kind of aggravated it. Calcaneal stress fracture, there is no pain on the first few steps and pain increases as the activity rises. It is opposite to plantar fascia. Plantar fascia, early morning, first few steps are painful. Calcaneal stress fracture, there are more pain as the activity increases. And there might be a small story or history where they have done excessive walking or marathon or Palithana or Tirupati or something like that, where they've gone, they've done a lot of walking and come back. Plantar nerve impingement, there would be tingling or paresthesia. Inflammatory condition, morning stiffness and other joint problems can cause this. So these are the basic differentials. Now going next to your retrocalcaneal heel pain, that's back of the heel pain. Again, very common condition in our country where we see this bump of bone on the back of the heel. This is how it looks like. It's red, swollen, pain at the back of the heel. This is an X-ray that you see, and this calcaneal calcification is pathologic, and this is what it looks like. So again, they do very well with exercises. There is a program which involves stretching and eccentric loading. This is how it is done. You need to stand on the edge of the step and go, let your heels fall down. While all of you all are doing it, make sure that you have something to hold on to in case your balance goes or something like that, and that will help you balance while you're doing this. If very rare, like 1 in a 10%, if this pain is troubling you, you need to remove this and repair. So we do keyhole surgeries where we do not do open surgeries for these anymore. This was the olden times open surgery. And what we do now is keyhole, where there is endoscopic surgery where we clean everything and repair the tendon down. So this was the two basic pathologies that come very commonly with heel pain. And this is how it looks like. So very sometimes in elderly population, what we see as the Achilles tendon is ruptured, so that tears. That also comes something similar to heel pain, and they are not able to walk. So there would be a gap at the back of the calf where you kind of see patient is not able to push off. They limp while walking, and they can be easily treated with a proper functional rehab where they are given a boot to walk on, uh, and then proper physiotherapy. Rarely operations are done, like, and again the operations involved nowadays are keyhole, where we do something like a mini open Achilles technique. This is the small cut, this jig goes in like like an endoscope goes in, and it is repaired. So this is how the tendon comes out from both the sides. And what we see is after the surgery, some rehab, and this is a small cut that we see over there. In old ruptures, like really old ruptures, where the gap in the tendon has become so much, what we do is a tendon transfer surgery. Again, it's all done endoscopic. This is how it goes. This is the extra tendon which is there next to it. We harvest it with our camera and special instruments, and it goes in over there where the Achilles was and fixes just with two cuts. So before we go ahead, I guess any questions for flat feet? Uh, uh, so uh, Nandini ma'am is asking about bunion toe. Nandini ma'am, just in the next part of the talk, we will be talking about toe deformities like bunions and other toes, and how we can manage them. Uh, Datta madam feels is not getting sound properly. I guess Kushal, please find that out if everything is fine. Fabric and pure leather shoes. So very good question. Indira ji has asked, she has bad sensation in her toes. So what shoes she should wear, whether fabric or pure leather? I prefer you wear fabric shoes because they are softer. Uh, in people who have poor sensation, especially like diabetics and all, uh, the dictum goes that you have to take care of your feet like a young girl takes care of her face. So you have to be careful because your sensations are less. Anything pricks you or cuts you, you will not feel that. So a patient comes walking to me as if nothing has happened, but their toes are bleeding inside their shoes because a small pebble got into their shoe. So when you have poor sensation in your feet, like how elderly ladies are told to do breast examination or men are told to look after their prostate, feet have to be taken care where every day you make sure that your shoe is clean. Put your hand inside the shoe and make sure that there are no pebbles or nails or anything inside. You also need to make sure that there is no moisture while cutting your toenails and all. You have to don't go too deep or something like that. So you have to be careful about your shoes and your feet when you have poor sensation. Uh, Due to long feet, toes get twisted in sports shoes? No, not because exactly in sports shoes, but if your front half of the toes shoe box is too tight, it can get twisted. So you need slightly broader toe box. You get those options easily in Skechers or Asics or something like that. Where are ortho chappals at old age? Uh, Lalita ji has asked, ortho chappals are useful at old age? Yes, they are useful because they are comfortable. They protect your delicate, soft skin from getting any injury over there. Uh, I think this is the second thing where a sound is low. Yes, we need to work on it. Cure for dryness, roughness, cuts under the feet. Very common condition, especially in winter. You need to moisturize your feet as you moisture other parts of the skin. Any moisturizer like Nivea, Body Shop, anything or Lakme, make sure that you moisturize at least twice in a day and let the hard skin automatically become soft. Is surgery advisable for 78-year person? If you ask me, age is a number. Surgery more than the age depends on the demands. So there are people who are 45 but are extremely low demand, like they have 10 people working for them. They don't even move from their bed to their dining table to have their dinner. I will not advise surgery for such people. But for someone who is independent, say like my dad who is at 74 and still works, he drives his scooter everywhere. If anything happens to him, I think he himself will want a surgery so that he gets back on his foot. So more than age, I would say the demand, and also other comorbidities where if you had uh, other heart problems, diabetes and everything, then you need to weigh the pros and cons of surgery. uh, Flatness, flat foot is what we are going to next cover, Shivaji. So maybe what we can talk about that. How long we can wear? Very good question. How long can we use a footwear once purchased? So normal average guideline is 1000 kilometers you need to change. So 1000 kilometer in a runner can happen in like 2 months, 3 months. 1000 kilometer in someone who is like not walking much can happen averagely in a 1.5 year. So every 1.5 year, I would advise my patients to at least get your foot measured. So your foot slightly opens up with age because of the ligamentous laxity. Your shoe size may change, and that might trouble you. So 1.5 to 2 years is what I would advise. Uh, Ankles getting swollen, we just answered that, saying that you need to be very careful about why it is happening, whether it is arthritis or deformity or something, and we'll take things accordingly, see a local doctor to help you out. Shushma ji is saying my two nails of feet have become hardened and thick, due to which they hurt in wearing shoes. So you need to trim your nails. Hardened nails are because of nail bed fungal infections. They're extremely difficult to treat. Uh, what I would suggest is maybe regularly crop them and see a dermatologist who can give you some lotions to soften your nails, and that might help you to overcome it. So I guess maybe a second break over. Uh, we'll go ahead and talk about flat feet. Again, another very common problem, uh, commonly seen all across the people, all across the population, commonly maltreated because people are told a lot of things about it which may or may not be true. And as always, there are a lot of misinformation about this. So, what is a flat feet? And today, because we are dealing with our senior citizens, we would be talking about adult acquired flat feet. So, arch height, like a human height, is variable in population. So, low arch need not be pathologic because there is a wide variation. When we call flat foot as pathology is when there is an abnormal loss of arch with pain. So without pain, they are flexible. We call it physiology. That's normal. With pain is a pathology where we call it abnormal. So flat foot, as we all know, with age, medial arch collapses and associated with deformities where the toes go here and there. So that's what happens. So it is like a three-dimensional deformity where the back of the foot goes outwards, front of the foot turns upwards, and the deformity happens in three directions. All the three directions, there are certain deformities over there. So whenever there is pain, most often there is pain on the inner side of the ankle or on the outer side where the outer ankle bone pinches on the outer side. So there can be impingement, there can be inner side tendon related pain or wear and tear arthritis. Very common, we see this a lot in patients who've undergone a knee replacement and they're not able to walk because their foot has become more flat. So they've done a big surgery for the knee, but their whole goal of walking is not possible and they're not able to walk on your one foot normally. So what we do in evaluation is first take standing x-rays where we see how flat the foot is. We see the alignment of the back of the heel, and depending on the stages of the flat foot, treatment is advised. So primarily the treatment is good arch support footwear and rarely surgical options unless you are really advanced in your flat feet where there is a deformity and arthritis and every step becomes painful. That is what we do. So in stage one, very rarely we do this debridement, but most of them need insoles. In stage two, there is correction of each of the deformity and certain aspects of surgery on this, where you do a tendon transfer, where one tendon which is not working is transferred to the another tendon. And this is what is the option. So this is the flat foot where she was not able to walk and now she's able to walk post reconstruction. So in stage 3 and 4 where there is deformity and arthritis is where you need to do surgery more often than not, and you need to fix those deformities with certain screws or plates and nails. And rarely we do an ankle replacement. This is an ankle replacement like knee replacement in stage 4. So what people used to tell us that you have to live with it with such flat foot, what we've seen is there is a solution and patients are happy with the solution where they can be reconstructed arch and the pain can take away and get them their quality of life back. Any questions on flat foot? uh, So not much questions on flat foot. So I think previously there were questions on flat foot. So I think these slides would have mentioned that you can wear good arch support insoles. Nowadays you get them customized at most corners Like there are at least 8 to 10 guys who do it in a city like Bombay. There are many more all around our country. Insoles is what is the first line with proper physiotherapy, and that is what I guess helps people come out of it. Reasons for top of the foot swelling, again very difficult to tell because there can be 100 reasons. Most probably it's age related wear and tear where the deformity makes you feel little swollen, but you should also check with your physician because certain foot swellings are associated with heart condition and kidney condition. Those are bigger and major life threatening conditions and you should do that. uh, Mr. Patil's daughter is a Bharatnatyam dancer and has flat foot, uh, and has pain sometimes. For sometimes pain, I would say she should stay away from doctors because doctors are not good to go to when you have sometimes pain. But yes, if the pain persists, uh, then she should get her X-rays, and depending on the X-rays, we can suggest how she can prolong her passion for Bharatnatyam and carry on. In Bharatnatyam, she can't wear shoes, but other times of the day where she is otherwise going to work or college or something, she definitely can wear those insoles and can help her feet breathe slightly better, where she can do Bharatnatyam better. Exercises do help flat feet, not directly, not directly, but indirectly. Flat foot is a bony deformity. So by doing exercises, your arch doesn't come up. But by doing exercises, what happens is you get the strength in and around those bones, like the muscles that support those bones become slightly stronger and they don't allow the foot to collapse that easily. So it's important that whether any part of orthopedic problems which has bony problem always will have muscles around it, and those muscles will need physiotherapy. So that physiotherapy bit is very simple. It's basically moving your toes, turning your foot sole inwards towards you, and stretching your calves. So it's important that those simple exercises your doctor tells you, you do it once or twice under supervision so that you learn the correct form of exercises. I purposely didn't put any of the exercises over here because I've had one unfortunate incident where I have shown videos of the exercises and the patient used to do them, and actually it caused them more harm because they were not doing it correctly, and that is what troubled them. uh, that's what it would be. My feet feel warm and tingling at rest. It can be because of diabetes, or more often because of diabetes. Then it can also be because of some spine where the nerves are getting pinched. So you need to get it checked properly and do them accordingly. Burning feet in the night, again very common reason is diabetes. What happens in diabetes is there is peripheral neuropathy, diabetic peripheral neuropathy, and that is what troubles patients with altered sensation. Altered sensation can be burning, throbbing, tingling, numbness, super sensitivity, everything. So diabetes is one of the worst enemies that you can have for your feet. So I think we still have in like half an hour more. I'll just try and continue and touch base on a few of the other common things that a lot of my patients come with foot related problems in senior citizens. This is what we had a question on bunion. So if you see this lady's feet, they are extremely well kept, properly manicured, properly pedicured, um, and nail painted and everything, but the deformity is troubling her. And if you see, these toes are also slightly becoming what we call it as cock up toes. So painful deformity of the forefoot at this joint with angulation of the toes is what is called hallux valgus or a bunion. And this is how it looks on the x-ray. If you take a standing x-ray, it's all bent, and the goal of treatment is number one, removing pain. It is never done for cosmetic reasons. It is done for pain, to allow proper weight bearing at different angles or different metatarsals, to and to obtain a shoeable foot, because sometimes this bunion deformity makes your toes go slightly broader and then you can't fit your foot into your shoe. So getting back into a fashionable narrow shoe is not a realistic goal. So these are the primary goals where one should touch or operate the bunion. Otherwise, you do not touch the bunion. Non-operative treatment for bunion is broad accommodative shoes where wide toe box with or without some insoles. Rarely surgeries are described where there are many surgeries. Not one is the correct one, but yes, for appropriate patients, appropriate surgeries and appropriately selected procedure will give extremely satisfying result. Like you see in this lady, she had this bent toes where we corrected it and fixed it, and now she is happy walking around with a normal footwear. So this is what we do for bunions. Next common problem is, as we had a few questions on them, front foot, like the forefoot having pain, and these are the various reasons that can happen where there is certain fat atrophy, certain joint synovitis, arthritis, some high arch foot, and very commonly neuroma, where there is a nerve swelling, happens very common in ladies, especially in your 60s, and what it needs is a very simple procedure. So any nerve disorder or entrapment can cause this neuroma, abnormal pressure from bones, ligaments, fascia. Consider other nerve disorders such as peripheral neuropathy or neuralemas for other disorders. And this is the compression neuropathy, where this nerve gets pressed in between them, and that is how it goes. What we do is we do a sonography and we confirm the neuroma and we inject the neuroma with a small local anesthetic, and it does really well. Very rarely in painful patients, we need to kind of do this removal. So coming last to, this is one of my favorite slides, one of my favorite patients who wanted to dance in her daughter's wedding. So if you look at her again, this is how she walks. She had so much of pain. She had been to, like, I think 7 or 8 doctors in Ahmedabad, Gujarat, and then come to me in Bombay. Her only thing is now, this is March, in I think November or December, she had her daughter's wedding and wanted to dance in it. So we got her x-rays and we saw that yes, she had some 20 years back, some old ankle fracture. And now that ankle fracture had caused ankle arthritis. So if you have a knee arthritis, the option is knee replacement. But when you have ankle arthritis, you do have ankle replacement, but they are not that satisfying as these things. And she was very heavy, was very on the heavier side. So we discussed and we did what we call it as an ankle fusion operation. It's a keyhole surgery where you clean the ankle and fix the ankle. And they are one of the most satisfying patients that come to us. And now you see how comfortably she walks. This is her normal walking pattern. She can perform a single leg hop and no scars at all. So that is how satisfying it is. And she could dance. She drives a car at Rajkot and she is very, very happy. So in correctly indicated patients, proper keyhole surgeries do give extremely gratifying results. Similarly, calcaneum or heel bone fractures also can be done keyhole surgeries where they are fixed and past screws and they are very happy. So it's almost been an hour that I've been talking. I think I always like to end that we need to open our mind, as our eyes only see what our mind knows. So like foot and ankle disorders are not life threatening, but they have a very high potential to be life altering. And this is where we feel that, we as foot and ankle doctors can help our patients improve their quality of life to for the better, especially in elderly population who are independent or not dependent on anyone else. Thank you very much. And if there are any questions, I'll be very happy to answer them. So in the chat box.
Thank you, Dr. Abhishek. It was a great session and a mind opener for all us senior citizens. Thank you so much, beta.
Thank you so much, doctor.
Thank you.
God bless you. God bless
Wonderful.
you.
Thank you, sir.
Wonderful. Wonderful. Very thought. Very
Doctor, I have a
mind blowing.
question. Doctor, I have a question.
Please ask, sir.
Sir, I mean, I have seen some people walking on the front of their foot, keeping like this.
Correct.
Okay, and some people walking like this. I mean, is there any long-term effect on such type of walking?
No, actually, someone who's been walking right from childhood on that normally would not have any problems because their body has got used to that. The other disadvantage of walking on any one part of the foot is normally, as we know, foot has 27 bones and 32 joints. So I always wonder that it's a nature's or God's architectural design. So each part has certain function, like back of the foot has impact function where it stabilizes. The front of the foot has a function to push us off forward, like to help us walk ahead. So if you walk and don't use that properly, you are more likely to cause more wear and tear in certain parts of that joint or certain parts of that foot where you are loading it more often than not. So that is what I would say. But if it's working, I normally don't try and alter the way they walk. I try and give them certain shoes which can comfort that area which is being overloaded. I think that is what, but you should not try and change much about it.
Dr.
Doctor, thank you.
I have a small
I like to know if high heels are not advisable.
No, not at all. High heels are not advisable is a myth. There is a way of selecting high heels, like how high you can go. Like I've written articles on it, how high you can go, and it also depends on what is your natural balance ability, because heels need the ability to balance, because your balance, instead of being on a flat surface of your foot, is on 2 points, one on the front and one on the back. So those 2 points make you vulnerable to injuries. But if you have inherent, or if you've developed or practiced how to walk with high heels, like I have enough patients who walked on high heels for 40 years, 50 years, and in fact they can even run in heels and catch local trains. So I think high heels are a taboo would be a wrong thing, but improper high heels or extremely high heels or not adequately training to use those high heels are something like a recipe for disaster.
Thank you, doctor.
Raghupati ji has asked a
One
very...
question, doctor.
Yes.
Dr. Abhishek,
Yes, yes, sir.
Hello, doctor. One
I
question.
just talked to you about my swollen ankle. Now, this swollen ankle, can it be because of a fracture I had when I was in school 60 years ago? Or can it be due to a buildup of uric acid?
It can be because of both. Old fractures, like especially while we were young, can over a period of time cause wear and tear and cause what we call it as secondary post-traumatic arthritis. That's one reason. Uric acid is a kind of inflammatory arthritis, which is like you get more of swelling when you had certain food types like red meat, certain alcohol, certain things and everything. That can cause uric acid related arthritis. Both can cause ankle swelling, great toe swelling, foot swelling, and the treatment for both are different, and hence it's important that your doctor diagnoses them properly and treats you appropriately. Before we go ahead, I think there are very important questions.
Hello, can I ask some question, please?
Ma'am, 1 minute.
Doctor, can I ask you one question?
1 minute.
Okay, there is an important question: how to prevent cons in feet. That one part I didn't touch, but that's really nice that someone brought it up. Raghupati ji and Usha ji both have asked the same question. It's important that you understand why the cons have come. So cons are body's reaction to overuse or overload on that one point. So if the cons, like, someone who lifts a heavy bag all the time will have hard skin on your fingers. Similarly, if you walk on one point and not on all the proper feet, you will have cons over there. How can
Doctor,
you? Yes.
doctor,
Oh, wait.
doctor,
Sound is not correct.
Can
Sound
I-
is not correct.
No, sound is correct.
can I come to you, doctor?
No,
Yes.
no, doctor has
Hello,
not completed.
my name is Urmila Lal.
Urmila ji, you are most welcome, but I'll just complete this answer. About
Okay.
cons, how do you prevent them is at those points which are being overloaded, where you are getting cons, especially in elderly population, you get customized shoes, which at that point is made a small cut or a small crater, which doesn't allow that point to be loaded. So these are customized insoles that are made for special people who have extremely painful con. So those cons can be easily dealt with over there. So that is the mechanical way of dealing with it. There are chemical ways also, where you get certain lotions and you can apply them, and you can take care of those cons by that makes that skin soft. And while you take a bath, if you scrub them, over a period of time the con vanishes. But the important part is not to let it happen again. So one is treatment and one is preventive, not to let it happen again, where you need these shoes and customized footwears. So
But what is the difference between the callus and corns?
both are the same. Callus is the medical terminology, con is the local.
But I have my left this thing for so many years, 30, 40 years. Two places are there. Every day with the back heel scraper, I scrape it every day before bath.
Correct.
But it's not corn, it is not deep paining. Only if it grows extra, it hurts when I'm walking. Otherwise, no.
So then I guess if it is not hurting.
Doctor say it's the callus.
So doctor will tell it's a callus, but for common people, it is called a con. So callus is our way of explaining or our way of learning it in medical school. Callus is something that is overdone more than necessary. So that is the mean of callus for us in Latin. But it is the, yes, ma'am.
I just want to ask you, where can we come and consult you about ourselves? Do you have your clinic here in Pune?
In Pune, I do visit once a month. This number that is there on the screen, 9920861187.
Okay.
If you message me on this number, I come to Pune. My clinic is at Camp next to Ruby Hall, and I operate at Jupiter Hospital and Sahyadri Hospitals in Pune.
Next to Ruby Hall, where exactly?
Once you go ahead from Ruby Hall, there is a Wadia College, I think.
Right.
Just opposite to that, there is a orthopedic specialty clinic of Dr. Sachin Tapasvi.
Okay, you are with Dr. Sachin Tapasvi, are you?
So I come and consult at his clinic. He's very kind to me, very allows me to use this space once or twice a month whenever I come there.
I'm a patient to Sachin Tapasvi, that's why. I just wanted to know about something I wanted to clarify from you regarding my feet.
So you can come and see me there. I was there 2 days back on 3rd. Most probably I'll be there on 19th in Pune. But
what are your hours of seeing patients?
Normally we start at around 10 o'clock to 12 o'clock, but you can message me on this number and we'll take it up from there, ma'am.
Thank you very much, doctor. Thank you so much.
40 years back, I had a fracture. Left right leg. Ankle.
My name is Shardamani.
Like this.
I want to talk to you.
Doctor says it is the after effect of the fracture. It's the arthritis. We cannot do anything.
No, I would disagree on the last. Showed you in the few, as I showed you a few slides back, that lady was also told the same thing, that nothing can be done and it is arthritis, and we've shown good results in her. So yes, arthritis is there, but there is definitely a solution to arthritis. And once we evaluate you with your x-rays, or if you can WhatsApp me your x-rays or pictures, I'll be happy to help you out.
I am 79. Is it worth going for the operation?
If the pain is worth bearing, then don't go for the operation. If the pain is unbearable, then you should think about it.
When you take the painkiller, it subsides.
Oh.
Doctor?
Yes, ma'am.
My name is Shardamani from Bangalore. I have got a flat foot from the last 7 years. I am wearing shoe that insole inside the shoe. I am purchasing Nike company shoes, and the doctor advised me to wear. But it is little bit weight. Which shoes I have to use?
So
Without insole, I cannot able to walk, doctor.
correct. So
I am not able to walk with in slippers.
no, ma'am, if you have a flat foot deformity, then slippers or plain shoes or plain footwear will aggravate your arch to collapse more and cause you trouble in walking and pain in walking. So you need insoles. What shoes? Yes, certain insoles.
I am using Nike company shoes. I
Sure.
purchased one insole that is 3,000 nearly. It is imported insole. Now it is better, but in the house, how can I wear that shoes? Which type of shoes I want to wear?
So,
In outside, I am wearing shoes.
So at home, I would suggest Hush Puppies, Hush
Huh?
Puppies, Hush
Hush.
Puppies, Hush Puppies from Bata has
Puppy.
a Hush Puppies from Bata has a series called Body Shapes. Body Shapes from Hush Puppies. They are very good couples. They have some amount of arch support in them, inbuilt, which I tell my patients to wear it at home while they are at home. So while going outdoors, they can wear their insoles and other shoes. But in our Indian population, we can't wear shoes at home. So these chappals for home by the name Body Shape by Hush Puppies. They are available in Bata, ma'am.
Bata. Okay. Thank you, doctor.
What kind of slippers are
Doctor.
these?
Thank you. Very
Hello,
nice.
shoes.
Hello, one
Hello.
question, doctor.
Abhishek,
Yes,
for
ma'am.
This is
us senior people, we must have anti-skid tiles in our bathroom. Bathroom are the maximum places where people fall.
100% agreed. And not just anti-skid ties, sir, but you should also have, there are certain bars which are available while getting up from your toilet seat. The toilet seat should be elevated. It should not be too low. All those things are important. There are a lot of things that can be done very easily. Uh,
Hello, Dr. Abhishek.
yes,
Can I ask one question?
yes.
Hello,
I'm
only one.
ready.
Hello.
Hello, Dr. Abhishek, I would like
I'm
to ask
audible.
a
Am I
question.
audible? Hello.
yes.
आपको मेरी आवाज आ रही है, Dr. Abhishek?
हाँ जी.
हाँ, Dr. Abhishek, I'm 74 years, and you see, 15 years back I got an ankle fracture, but वो मेरा fracture पूरी तरह ठीक नहीं हो पाया था. With the result, I'm having my knee problem. So can you suggest some which shoes I should wear? I'm just wearing Bata shoes and all. But as because since you are an expert, so can you suggest me any shoes? I'm 74.
What I would suggest is you can I think again a proper thick-soled Skechers or something should be good, ma'am.
अच्छा, तो वो कहाँ मिलेंगे? कोई मतलब बनवाने पड़ेंगे दिल्ली में?
नहीं, दिल्ली में आप Skechers का कोई भी दुकान होगा ना, Skechers नाम की एक कंपनी है.
अच्छा.
तो आप पूछ के बोल सकते हो.
अच्छा, okay, stretcher. Okay.
Hello, doctor. This is Zareen Mehta. Can I ask a question?
Then how will they get in?
Hello, doctor.
Yes,
Can
ma'am.
you hear me? This is Zareen Mehta.
Yes, ma'am.
Can I ask one question? I have a varicose veins ulcer at my ankle, which is not healing.
Okay.
It started in July. It's not healed as yet, but it is spreading to a wider portion of the ankle. Now, what should be done, and can I do some exercises of the ankle?
What I would suggest is for your varicose ulcers, means that means when there
Yes.
is a skin breakdown, you should
Yeah.
first and foremost try and get a skin coverage done, because that ulcer can predispose you to infection, because there is no protection. Any outdoor germ can come and sit over there and cause you trouble. So what I would suggest is, you need to see a proper uh, what we call a general surgeon, or someone who will take care of all of those things for you. And along with that, you should try and exercise. But in exercises, considering that you have varicose veins, you should focus on your calf stretches. That is, you need to stretch your calves up and down as much as possible and work on your balance. But do not neglect your ulcer, because that ulcer is a raw area and can cause you bigger trouble sooner than later.
What exercises for the calf muscles?
Stretch your calves adequately, ma'am.
Stretch my calves.
If you
Like
just,
how
if you
what should
can
I
just,
do?
if you just Google calf stretches in YouTube, you will get a couple of good exercises that you can see and do it.
Some with a ball, press the ball, putting at the corner.
No, ma'am. There are simple ones, that is standing on the edge of the step and going and doing it. Uh, I think if you see it, you will be better to understand it rather
Yeah.
than me just telling it right now.
Yeah, that is true.
Can I do this exercise, or will it aggravate more the ulcers?
No, I think that's the reason I want you to see a surgeon first, who will.
I have seen a surgeon. Since July, I have seen surgeon, and all that is done is given these medicines like Neurosporin or Fusidin and all these things for dressing, and asked me to dress up the wound and apply crepe bandage. But the wounds are not healing, and the wounds are spreading. It's spreading
So that is
to
not
the
a
other
that is
parts of
not a
the
good
ankle
sign.
also.
If it is
Hello?
spreading, it's not a good sign. Please discuss with your surgeon uh, about what further things needs to be done, and I would request you to be slightly more aggressive with your treatment and not take it lightly, because those ulcers can cause infection.
Doctor,
Not good. Yes, ma'am.
Hello, yes,
I am
doctor.
Urmila Jain from Sanjay Nagar
Sometimes
Chowdi.
the infection could be dangerous.
Yes, of
And
course,
what
any infection can be dangerous, ma'am.
no, what would be the like if not treated properly, what could be the ultimate gangrenous? Can the
Basically, it's no
That your
problem.
surgeon would be able to tell. I have not seen your ulcer, so it's very difficult for me to comment on how bad it can happen.
Okay, so
Hello, hello
everyone.
doctor.
Yes.
I am Urmila Jain from Sanjay Nagar Chowdi. मेरे लेफ्ट पैर में बहुत ज्यादा सूजन रहती है और दाएं में कम रहती है और चींटी काटे वैसा होता है.
तो आपको आपके डॉक्टर को दिखाकर आपका स्पाइन चेक करवाना है. जो चींटी काटने
Razia, that's my job.
वो आपको स्पाइन का प्रॉब्लम हो सकता है. और वन साइड, मतलब एक पैर का सूजन एज कंपेयर टू द अदर साइड इज आल्सो बिकॉज ऑफ सर्टेन ब्लड प्रेशर रिलेटेड इश्यूज. तो आप आपके फिजिशियन को एक बार दिखा के फिजिशियन को दिखा के एक बार अच्छे से चेकअप करवा लीजिए मैडम. ये बोन्स का प्रॉब्लम नहीं है जो आप कह रहे हो.
ओके, टेस्ट तो सारे करवा लिए डॉक्टर. ऑल टेस्ट आर क्लियर.
No, but that's what. So maybe discuss with the physician. There has to be some reason for which this to happen. It can. There like this. आपका आवाज नहीं आ रहा है. या कुसुम is going to say something, I guess.
बीपी का गोली चेंज किया उन्होंने.
हाँ जी, तो फिर वो बीपी का ही प्रॉब्लम होगा जो आपको ये तकलीफ दे रहा है.
Okay, so everyone, let me thank Dr. Abhishek Kini for his enlightened discussion, his knowledge, experience sharing with all of us. Thank you so much, Dr. Abhishek Kini from whole team of Dignity Foundation. Thank you so much. And everyone, there is a number of Dr. Kini You have, I think most of you have already noted down. You can take it from me, or he can share it now also. So if you have any further queries, you can call him, you can visit him, you can visit his clinic, and I think he'll be.
Thanks a lot.
Are you available at Reliance? Are you
Yes, ma'am.
available?
Yes,
You
ma'am.
are. Right.
Dr. Abhishek, Dr. Abhishek,